Hi, and welcome back to our series, How You Move, presented by HSS here in Chelsea Piers, Connecticut. My name is Justin Clark, the Director of Outpatient Rehab Services for HSS in Stamford. Today, we're joined by two HSS physicians and one local high school athlete from Wilton High School, who also plays for CFC United. Today, we're going to be discussing injury prevention and soccer-related injuries. I would like everyone to introduce themselves, starting with Alana.
I'm Alana Albert. I play soccer for Wilton High School. I play on the varsity team, and I also play soccer for CFC United.
I'm Daphne Scott. I'm a primary care sports medicine physician here at HSS in Stamford. I've also served as a team physician for the 2017 USA Track and Field team at the World Championships in London.
I'm Maura McCarthy. I'm an orthopedic surgeon at HSS. I specialize in knee and shoulder injuries in active athletes. I take care of the Long Island Nets NBA G League team, and I'm a former soccer player myself.
So Alana, we know that you're an elite high school athlete. You play soccer. We know that for Wilton High School, are there any other sports that you play right now?
I am focusing on soccer right now. I used to play lacrosse as well. I play center midfield for soccer, and I'm a sophomore.
Gotcha. Now, do you play center midfield for your club team also?
Yes.
You do, okay. Are you practicing year-round?
Yeah, I practice year-round.
So can you tell us a little bit what happened over the summer into this season?
Well, we had a lot of summer training. We had Hell Week. We did some injury prevention along the way, and we went straight into soccer season. We had 2-hour practices every single day with little breaks, and we had games 2 or 3 times a week.
Gotcha. And can you tell us a little bit about, you mentioned injury prevention. Is there anything specifically that you or your team does to prepare for the upcoming season?
We use elastic bands to try and work on hips and to strengthen the muscles around your knees, I guess. So we try to do ACL prevention.
So we talk a lot about injury prevention, and I think we talk a lot about in our offices, in rehab as well. But there's such a big focus on injury prevention and risk reduction of injuries. But sometimes we see no matter what we do when it comes to injury prevention, we still have plenty of athletes that suffer injuries. So can you guys tell us a little bit about, when you see athletes in the office, what you give as tips and kind of education and feedback for them leading into their high school or club seasons?
When I see someone in the office, a lot of the times what I like to review is just their overall medical history. If they've had an injury before, what they did to rehab that injury to get back on the field. We know that a big risk for having another injury is having previous injury. Additionally, a lot of what goes on with the exam is focusing on how strong they are with regards to core muscles and those sorts of things. It's very important that we have those supportive structures being strong, so when someone lands, that they land in a safe way so as not to injure the knee.
So Dr. McCarthy, I know that you have a very keen focus on ACL injuries and ACL reconstructions. Can you tell us, or tell the panel a little bit about how often you see these type of injuries in the office?
Sure. So unfortunately, when we see patients in the office, usually they've already had an injury. So we don't get the chance to help teach them how to prevent injuries and how to keep themselves healthy. But when we see them in the office, it's a little bit tough because we have to deal with the injury. We usually discuss sort of treatment for the injury, which usually involves some form of surgery, and then the rehabilitation afterwards. And a lot of times, the rehabilitation is the thing that's the most important, because it means getting all the muscles back in shape and getting yourself to a place where you prevent further injury to both that knee and the other knee.
And Alana, I know that you and Dr. McCarthy have a history. You've seen her in the office and actually had a surgery performed by her. Can you tell us a little about your injury and how it happened and how it occurred?
I was playing in a game and I boxed someone out. My injury was a contact injury, which I know is less common. And she came up from behind me, and my whole body spun one way, my knee went the other.
I think we see more often than not in athletes that ACL injuries occur from a non-contact and kind of a benign cutting, landing, something to that effect. So I think in more of a rare case, she actually had a contact injury during her sport. maybe we can go into a little bit more about the female athlete and risk of injury and ACL injury specifically for the female athlete. We can just elaborate on that a little bit.
Sure. Yeah, so female athletes are at higher risk for certain injuries, and ACL injuries are one of those for a variety of reasons. Some deals with alignment of the lower extremities. Females tend to have more of a knock-knee alignment or a valgus alignment. Other risk factors have to do with strength and landing characteristics and muscle activations. And a lot of times, some of the things we pick up before people have an injury, or hopefully to prevent injury, and in this injury prevention program, are sort of hip strength, core strength, jumping and landing mechanics. Because a lot of times these are non-contact injuries, so you plant your leg and your body goes one way and your knee stays or goes the other way, or you land awkwardly. But in Alana's case, it was contact, and so those can happen too. It's just a function of the forces across the knee as you're doing certain things.
In what we do, we always talk about modifiable risk factors and those risk factors in which we can't change. And so when someone comes into the office to see us and I notice that they have core weakness, or notice that when they do a single leg squat, their knee goes into a valgus position, those are things that we can try to work on with strengthening them and sending them to see a physical therapist like you and your colleagues.
Sure. Now, when you see an athlete or non-athlete, anyone with an ACL injury in the office, is it common for you to recommend therapy before surgery, or depending on the type of injury or the extent of the injury, is it more let's get the surgery done and then get into rehab as quickly as possible?
That's a great question, and usually there's a period between the injury and the surgery where you have to rehabilitate, you have to get the knee to kind of calm down, you have to get some motion going. You don't want to do the surgery too soon, because then you can deal with other problems after surgery like stiffness. You don't want to go too long before doing the surgery, however, because you don't want subsequent or further instability events to happen, which can result in other damage like meniscus damage or cartilage damage.
Right. Now, Alana, after your surgery in particular, were there any speed bumps or anything that you ran into that you found specifically difficult following your surgery?
I think there were a lot of challenges after my surgery. I think the fact that I couldn't put weight on it for so long and had a brace, and I think one of the hardest things was getting my range of motion back again. I couldn't straighten it out all the way, I couldn't bend it all the way. Still can't bend it all the way, but it's getting better.
How far out from your surgery are you, Alana?
About 6 months.
I think one of the interesting things that comes up is in the news we hear about these professional athletes that tear their ACL and are back playing in 6 months or 9 months. And I think that the reality is that for most of our young athletes, if they have an ACL injury, it actually takes a lot longer than that. And that's one of the important things that we have to try to get across to our young athletes that injure their knee, that it's very unfortunate that it has happened, and it will take some time to get back, but our goal is always to get them back doing what they want to do.
And I think also in our post-operative patients and our non-operative patients, the studies show that the longer that someone is held out of sport and they do very specific and specialized rehab, that they're less likely to have these recurrences of injuries of the same type or a different type of injury. So I think it's, like you mentioned, it's hard to kind of refocus athletes and their parents and coaches and all that and get them to really be on program with what we're saying to them in the office. Because a lot of times people are all gung-ho, they want to get back to playing, and it's just not, you really have to rein them back in and make them realize that it's not the best idea in the long run at all.
Going back to some of the challenges after surgery and with rehabilitation is range of motion. It's really important to get your extension or getting the knee nice and straight after surgery as early as possible. That goes along with getting your quad strength back, which is another muscle group that we work a lot on after surgery, as you can let us know. And getting your flexion or bending the knee back. The other thing that you guys were talking about is sort of time to get back to certain things. And so typically, depending on if you have other injuries like meniscus or other things treated inside the knee, it will take you approximately 6 to 8 weeks to come out of the brace and go off the crutches. And then it'll take you approximately 3 to 4 months to start running again. And then it'll take you somewhere around a year to get back to play most of the time. there are some people that go back a little earlier, and there are a lot of people that go back a little later. It's not dependent on the time frame, it's dependent on the function and how much we can lower your risk of re-injury.
We'll be right back with more How You Move, coming to you from Chelsea Piers, Connecticut.
It's not only an awesome experience working with the wonderful surgeons at HSS, it's also nice having you guys next door. I know there have been multiple times when you've been able to come next door and ask me a question, or vice versa. I can come over there and ask you a question.
Right, being able to work so collaboratively with the doctors, the patients, and rehab, I think is a key and a huge plus for us here in Chelsea Piers, in Stamford, because we really get to draw in all the local families, the high schools, the athletic teams. And I think what we see more often than not, we have patients that come in, we treat their mothers, their fathers, their relatives, their siblings, and I think it just goes to show and goes to, to speak to the great care that we give as our physicians, and of course on the rehab side as well.
I always joke around, my primary specialty is actually family medicine, so I enjoy taking care of entire families.
And we're going to have extra hours soon, so we'll be able to see more of these people that get hurt over here at Chelsea Piers in the afternoons. And it's a great collaboration between our primary care sports medicine doctors and our orthopedic surgeons. And we just want to do a great job for Connecticut.
I would echo that. It's been wonderful being able to bring the great care of HSS from the city out here to Stamford, Connecticut. We just want everyone to know that we're here to take care of the young, active athlete and get them back to doing the things they want to do.
Now, we've talked a lot about ACL injuries with soccer, with different sports. Let's discuss a little bit more about other common injuries that we see in athletes, weekend warriors, whoever it is that we see in the office.
One thing that I see commonly in really young athletes, especially young athletes who have just gone through a big growth spurt, are injuries in the front of the knee. So things like Osgood-Schlatter, where we have pain where the patellar tendon attaches into the tibia or the shin bone.
Yeah, that's a good one. There are a lot of pains that happen in the anterior part of the knee, either with overuse or weekend warriors or people who are training really hard or they start training a lot more. And a lot of those pains in the anterior part of the knee can be treated with good physical therapy, good workout regimens, good warm-up regimens, extra stretching as needed. And so a lot of times we see a lot of people who don't need surgery, they just need help to be able to do the things that they want to do.
I think a lot of times we hear, a common misconception about when you go to see a surgeon, it's, sign yourself up for surgery right away. But I think we all know from experience and from having injuries ourselves that that's not always the case. Oftentimes we take the more conservative route, try everything else first, therapy, injections, rest, whatever it is, and then we explore the route of surgery if it comes down to that.
Exactly. And I think going back to the history, a lot of the times when we actually talk to our patients, we're able to find out what brought on their pain. Sometimes it's someone who went from never playing a sport to playing 15 hours of that sport per week, and it's just too much for their body to handle. So sometimes we need to just back off a little bit and make sure that they're strong in the areas where they need to be to better protect the knee.
The other thing that's interesting is that oftentimes you don't need surgery for a lot of things, a lot of injuries. The times when you do need surgery usually are when you're perfectly fine and then something happens and then a minute later you're not fine. A lot of the other times when it's a gradual process or pain or things that come about over time, those things can be treated without surgery. And I spend a lot of time talking people out of surgery if they don't need it.
That she does. I will also say it's important for people to recognize when it's important to come in and see a doctor or a surgeon. If the knee is swelling, if they're having pain and they're limping, if they have pain at night, or pain that lingers into the next day or even lasts for a couple of days afterwards. It's really important that if people are having those kinds of pains, that they come in and have an evaluation.
I think what we see in our offices is that the higher level athletes, the more elite athletes, are the ones that actually experience and suffer from more injuries than someone who may not be as high of a level performance-wise. So, a lot of times they play through the injuries. They try to play through the injuries, and what it comes back to bite them when they do try to do those things. So I'm wondering, Alana, through your history of playing through high school and before high school and even up to now, were there other injuries outside of your knee that you've suffered that you've either played through or they've had to be addressed by anything or by anyone?
At the beginning of the season, my back was hurting me, so I stayed out because I knew that if I tried to play through it, then it might affect me in the rest of the season. And when I was younger, I also fractured my growth plate in my ankle. I think everyone that's really into the game, everyone that really enjoys playing, will try and fight through an injury. Sometimes it doesn't turn out the way they wanted it to, and other times they can just get away with it, but I think it's something that has to be addressed.
I think it's important when people come to see us, and if we recommend that they maybe take a little bit of time off for their sport, we always try to let them know it's not because we're trying to be mean. It's because we think that's what's best for them. We think that's the best way in which they're going to allow their pain to calm down so that we can address it and get them back to playing at their best. It's never fun to be out there on the field playing at 70%, correct? You really, if you're going to be out there playing, you want to be playing at 100%.
And really, if you don't go back playing at 100%, again, your risk of injury is so much higher than if you're right where you want to be, and then you go back out to the level that you were prior to your injury, or better than what you were prior to your injury. So it just goes to show how important it is to make sure that your exercise routines are great, your rehab is great, the doctors that you consult with are just as great. It just, all these points come together to make for a great finished product after rehab and then returning to soccer or whatever sport it is.
Alana, one of the things you brought up was having an ankle injury previously, and that's one thing that we see commonly in soccer athletes. When someone comes in to see me, in addition to evaluating their ankle and talking with them about an ankle sprain and what it takes to get back on the field, we also use that time to evaluate core strength, other muscle strength, just to make sure they're not putting themselves at risk for having other injuries, such as knee injuries or hip injuries.
My favorite thing to do in the office with somebody who is injured or not injured is to have them do step downs. They're like single leg squats, and they tell you a lot about the strength and the control of the muscle groups of the core and the lower extremities. And it tells me a lot about how much that person's going to need to do extra work to get to a point where they're not at risk for injury.
Exactly. And even if someone suffered just a mild ankle sprain, we know that that still involves some minor tearing of the ligaments at the ankle. And it's very important that we get them into rehab so that they decrease their risk of further injuring the ankle or having symptoms that are prolonged throughout the season.
And I know, one of your common assessment tools, like you mentioned, were the forward step downs or the step downs. And it does show a lot about the athlete, about the impairments that the athlete has. I think we know because we actually share Alana as a patient of ours. One of the things, like you mentioned, one of the things that you run her through in her office visits is the step down. I know we looked at that very closely in rehab. We looked at your squats, your forward step downs, making sure that your hips weren't shifting, your knee wasn't falling inward. We looked at alignment and good depth and good control. And without all those things, you wouldn't be back to where you are now and running and incrementally increasing your running. So Alana, prior to starting your running routine in therapy, can you tell us a little bit about the things that you were doing to get your body ready for all that?
We did a lot of step downs. I had to do 10 consecutive step downs on both legs because I can't forget about the other leg. I have to make sure both are even. We also did squats, and we also did a lot of hip strengthening exercises and things like that to make sure that I was ready to have the impact of running again.
So I knew we used the Ultra G treadmill before we got you back onto the treadmill. Can you tell everyone a little bit about what the Ultra G treadmill does and what it uses to help unweight your body?
I think the Ultra G was very helpful for my rehab because it helped me get back to running very slowly, but it wasn't too much of an impact at first because you can take the amount of body weight off, so it kind of feels like you're running on clouds.
What's been the most challenging thing about your rehab so far?
Definitely holding myself back from playing soccer. I think that's the hardest part, and I think the first 10 weeks were the hardest part because I couldn't really do anything that I wanted to. I went from playing soccer every single day to just not being able to do any physical activity, and I think it was really it was mentally challenging for me.
So you're 6 months after surgery now. What are some of the things that you think you need to work on to get back to playing full contact soccer?
I definitely need to work on my full range of motion because I can't bend my knee all the way yet. I also need to work on strengthening my hamstring and my overall balance.
I think not only Alana being a star athlete, but she's really a star patient for us in rehab. She works very hard on her own, which is tremendous because not every patient that we have, no matter how much we preach to them how important rehab is, they don't often do it outside of therapy. So where you are now just goes to show how hard you're working, not only with me in rehab, but at home and in the gym on your own. That's what's gotten you to where you are right now, and that's what's going to help you return to where you were playing soccer.
It's a totally different mindset because you said you were playing soccer every single day and now all of a sudden you can't play soccer anymore. But the other way to look at it is now you're rehabilitating and you're doing all these new things that you haven't done before. And these things are going to help you become a better athlete and they're going to help you stay injury-free.
I'd like to touch on that also. We know that an injury can be hard for elite athletes, and we know sometimes it can put you into a state where you're feeling a little bit sad, a little bit down. And so that's something that we don't like to ignore, and we definitely try to address with a lot of our athletes. So it's not something that's uncommon, and we make people just understand that it can be encountered, especially, as you said, when you go from playing soccer every day to not being able to even walk without crutches after surgery.
Every physician and every therapist encounters with their patients. There's more than just, speaking about the medical side and then speaking about the therapy side. There's also, you have to have a connection beyond just that because there are other hardships that you go through as a patient other than just the physical injury. There is the mental stress. There is, anxiety that you feel because you're out of the sport that you love and that you played for every day of your life. So we don't only have to have the skill of being able to perform a great surgery and give great consultation and great advice and great rehab and exercises, but there's also the balance of the other side, more of the personal side that we have to have with all of our patients. Thanks for joining us for another episode of How You Move, coming to you from Chelsea Piers in Connecticut. Please join us again next time.